Hi, my name is Dr. HysterSIsters, and I'm a gynecologist with a special focus on gynecologic surgery, offering women the latest advances in minimally invasive surgery and robotic surgery. I also have a special interest in diagnosing, treating, and managing women with BRCA mutations and other hereditary cancer syndromes. What is BRCA testing, and should I be tested for BRCA gene? BRCA testing, or testing for genes that may increase your risk for breast or ovarian cancer, is done to help us determine your risk for having the gene mutation. Testing allows us the opportunity to determine your risk for hereditary breast and ovarian cancer, and testing can also help reveal some additional syndromes that may be apparent in a patient's family and let us understand how to better manage patients with a strong family history of cancers. I'm BRCA positive. What are my risks and what should I do to minimize my risk? Being identified as a carrier of a BRCA or BRCA mutation can have implications for your future. Mutations in BRCA1 and BRCA2 are associated with a 45% to 87% risk of breast cancer by the age of 70 to 80. However, variability of this risk has been demonstrated among families, most likely due to other modifying factors. Most importantly, hereditary breast cancer occurs on average at an earlier age than the non-hereditary, or what we call the sporadic form. Women in the general population have only a 2% chance of developing breast cancer before the age of 50. However, a woman with a mutation in BRCA1 or BRCA2 have a 33 to 50% likelihood of developing breast cancer before reaching 50 years of age. The risk among women with a history of familial cancer is between 15 and 40%. The risk of ovarian cancer due to inherited BRCA1 mutation is 28% to 44% by the age of 70, compared to the general population risk of less than 1%, and the familial cancer risk of 4 to 11%. Mutations in BRCA2 confer a risk of ovarian cancer of 11 to 27% by the age of 70, which represents up to 15-fold increase compared to the general population and about 4 times the risk of familial cases. In terms of risk-reducing options and surveillance for BRCA-positive patients, the NCCN, or the National Consortium Cancer Network, along with other medical societies, agree that patients with a BRCA known mutation should undergo transvaginal ultrasound with a CA-125 every 6 months, starting at 30 years of age, or 5 to 10 years before the earliest age of first diagnosis of ovarian cancer in the family. Self-breast examinations at about the age of 20. Yearly mammograms with MRI combination, 25 years of age, and screening for melanoma yearly, with screening for other colon cancers or prostate or pancreatic or gastroesophageal cancers. Risk-reducing surgery can also lower your risk for breast and ovarian cancer syndromes. For example, bilateral mastectomy reduces risk 90 to 95%, and removal of the tubes and ovaries reduces the risk 80 to 90% to 2 to 6% lifetime risk. I'm BRCA negative, but ovarian and breast cancer are in my family history. How do I minimize my risk? Breast and ovarian cancer can run in families and still have an underlying mutation that may not necessarily be a BRCA or a BRCA mutation. For patients with these strong family histories, it is important that genetic counseling be obtained and risk estimates of breast and ovarian cancer calculated. Further information can actually be obtained about other potential genes affecting the family. What is Lynch syndrome, and what should I do to minimize my risk? Lynch syndrome is an inherited condition that increases your risk of colon cancer and other cancers. Lynch syndrome has historically been known as hereditary non-polyposis colorectal cancer, or HNPCC. The most important step that individuals can take is to learn about their family history of cancer, particularly colon cancer, stomach cancer, and other gastrointestinal cancers. But more importantly, for women, it is important to also know that a history of uterine cancer before the age of 50 in a family can raise concerns for Lynch syndrome. Testing can also be performed and offered for patients who may be candidates.